Well, welcome everyone. I'm Donald Weeks, the founder and CEO of ClearPath AI and host to the Clinic Efficiency Podcast. I'm really excited for today's conversation. Today, we're joined by Carlos Rodriguez, the founder of Humanate Digital. And Carlos, your career is truly impressive. From founding a cloud based medical records company to now leveraging advanced AI at Humanate Digital, it's clear that you're driven by a deep commitment to improving healthcare systems. Please tell us a little bit about yourself and about your background.
Well, first of all, Donald, thank you so much for inviting me. You know, I love to kind of share best practices. I think any organization kind of learns from best practices, and I really respect what you're doing, right? Which is how can we make healthcare better in terms of outcomes, but also more efficient, so we all can afford it. In terms of my background, typical immigrant story, where my parents moved to the United States to make sure that that me and my brothers have you know better better outcomes, so to speak. So in the case of my family, my two brothers are doctors and I'm an engineer with an MBA. And the first half of my career I spent with Bain Capital trying to make companies more efficient. And I can't tell you how many times I've been around the dinner table with my brothers, and they just seem to enjoy less and less of what they do in terms of being physicians. And a lot of it is things that are external that they can control, being all the regulatory, all the administrative tasks, and how little time they have to be in front of patients. So that's a really motive me 20 years ago, to join Baylor College of Medicine, and really got interested in how to optimize and help.
Yeah, that sounds great. Well, Carlos, your journey into health tech, and particularly after your wife's stage three breast cancer diagnosis, is incredibly powerful. What did that vision for fundamentally changing how healthcare operates really start to take hold for you? And how did it lead to founding Humanate Digital?
Yeah, so I'm glad you mentioned my wife. So my wife 40 years was diagnosed with stage 3 breast cancer 23 years ago. Our kids were like 10 and 8. So it's tough whenever your kids ask you, "Hey, is mom going to make it? Is mom going to make it?" So in that case, it was really the fact that 23 years ago, before the PAC system, all the mammography was done through X-rays. So if you remember those days, you would walk, with your Manila folder, and you would have this X-ray, and you would give it to the radiology tech or the radiologist to make sure that they reviewed the past one, because there was not a PAC system. So in the case of my wife, because we moved so much with Bain, a lot of the radiologists could not get her baseline mammogram and were just shooting annual shots. Therefore, they didn't catch the mutation of that cancer progressing. So that's what led me to my first startup, which was, why do we need to fax and mail medical records? In fact, the only other industry that still uses faxes are flower shops. But I remember, when I had my medical records release information company, it was hard for me to buy faxes anymore. You go down to Office Depot and it's hard to get a fax machine, but you see them in every office. And I can tell you how many HIPAA breaches are because, Mr. Jones' medical records, get tangled up with Mrs. Smith's medical records. And now you scan them, and now you just committed a breach. So I really think that technology can be an enabler, to make healthcare simpler. It will never replace a clinician, but I think that technology is needed to really improve patient access and better outcomes.
Yeah, absolutely. And with the companies you're working with today, how are they adopting it, positively, or I mean, are they having some issues with employees not wanting to adopt it?
Well, it's kind of interesting. So I got a chance to speak with the Cleveland Clinic CEO, and he was asked, what is the criteria for Cleveland Clinic to invest in AI? And he said, well, most people think it's just saving us money, but we really ask, the follow up question, and is, how is it going to help my employees, especially clinicians, right? So the criteria that they're saying is, hey, does this save me money, right? And second, how does it help my clinicians? when it comes to their satisfaction, their retention, their state of mind. And that's why ambient AI, which is scribes, has done so well in healthcare. In fact, when I used them, it was called Dragon for text to speech, and that's how we would capture the notations from the doctor so we can bill. Well, now this company is now Nuance, and Microsoft just paid $20 billion for Nuance. And Epic just announced that they're going to put it into the EMR. So now physicians can kind of search for things in the EMR through voice. So I really think that you know if you're able to articulate what's in it for them, you can really get interest. Now, for ourselves, we always respect the clinician's license and we want them to operate at top of the license. So, for example, one of our co-pilots is looking at the way the doctor's documenting, and if they miss anything, the avatar will say, not, "Hey, you made a mistake," but, "Hey, Dr. Ortiz, this is what I'm seeing. What are you seeing?" And we always let the clinician make the final determination. So as long as you respect, why a nurse went to nursing school or PA school or why a doctor went, we find that if we make their lives easier and it's better for patients, you will find a champion that will help you implement that technology in.
Yeah, absolutely. Well, Carlos, the Humanate Digital utilizes an NVIDIA powered large language model and a multilingual avatar named Cassie. It stood out that you're using machine reading IP from Texas and A&M. When you did that idea of integrating advanced AI with practical healthcare workflows, clarify for you, what's been the key in bringing Cassie to life with your team?
Yeah, so our intellectual property was filed 5 years ago through the Texas A&M University system, and it was before ChatGPT. I can tell you that before OpenAI and ChatGPT, that a lot of people were not aware of this technology. And the technology is really the ability to tokenize language so a computer can understand it. So you look at OpenAI, you look at Gemini, you look at Gronk, and it's amazing how many people like the fact that they can search, by talking to this thing. And I
Absolutely.
don't. And not only search, but it's a smarter search, right? So if my wife and I were going to Austin, Texas, to catch a band, and I want a certain hotel, all I can do is Google that hotel, and it tells me what they have. But Cassie can say, "Hey, you have a Peloton class on Saturday morning at 10. I'm going to look for hotels that have a gym, have a Peloton, and I'm going to go call ahead and reserve you a bike." Well, that's a different total experience. And it's the same thing in
Yeah,
health.
absolutely.
It's the same thing in
Yeah, could
healthcare.
we?
Go ahead.
Yeah, absolutely, Carlos. I was going to say, could we see a demonstration of your software?
Absolutely. So let me show you something. And
Okay.
I'll set it up here so you can see. Okay. 1 second. Okay. Can you all see my screen?
Okay, perfect.
Okay.
Absolutely. It looks great.
So we combine the LLM, which is the language part, and we're using the NVIDIA Llama 3.0 Nematron that is 30% more efficient than ChatGPT. And the reason that it's 30% more efficient is we only teach it life science and healthcare terminology. So she doesn't know anything about politics, sports, all she knows is healthcare. So that makes her a lot more efficient. So about 98% of the time we're able to answer the question, which is pretty high compared to 70% of others. So let me give you a use that we're working with a 23 hospital system. As you know, Donald, during COVID, a lot of the preventive procedures, such as mammographies and colonoscopies, were stopped just because we needed capacity in healthcare for sick people. So we're working with a healthcare system that has 6,000 patients waiting on a colonoscopy. Their operating suites are 30% right now working productive, but the rate limiting factor is that they just don't have people, whether it's a RN or an MA, calling you to do the preoperative consult.
Hmm.
A person has to call you only during 8 to 5 because that's when they're working. So now you have to figure out, when do I have an hour to talk between 8 and 5? And what they're doing is making sure that you are prepared for a colonoscopy. What medicines you need to get off, such as, if you're in any kind of blood thinner, you need to get off so you don't bleed in the OR. If you're taking GLP-1s, you got to get off, and then explaining prep and things like that. So what Cassie does is she's available 24/7, 100 languages, including sign language. And let me kind of, show you kind of what she does in terms of how
Okay.
how she does this. So, let me so again, you can put as many languages as you want. At this point, we're primarily in Texas, so Spanish is almost a necessity in most of our practices. Uh,
Sure.
so now, after this, it becomes a ChatGPT experience, meaning that she is following the gastroenterology protocol for a preoperative endoscopy consult, right? So she's following the
Okay.
guidelines. She's gathering all the information. She's
Hmm.
triaging the patient whether they need a second screen, meaning that if a patient has heart issues, we need cardiology to consult. If they've had adverse effect through anesthesia, we need anesthesia to come in. But we're helping healthcare sort the 80% of people that are ready to be scheduled today to the 20% that tomorrow need follow up from a human. So, what we do is we
Right.
gather the information. We always prepare a report within the EMR system and we send it to the human in the loop for approval. So, once we get that approval, we then can reach out to the patient and schedule them. So, right
Right.
now, a human can do about 11 consults a day. We can do about 200 per day at
Wow.
much cheaper cost than a human. So it's almost like, why do you need to burn a human where they can be in front of a patient or performing tasks that they went to school for? So that's the premise of what we do. And what's really good about that is the fact that you can really demonstrate to the office manager, to the doctor, physician, or to even we have a way to save them money because what we're doing is we're lowering cancellations because Cassie keeps up with that appointment and it for reminders. Second, we're avoiding the labor of the nurse having to do this. And then third, we find that she has a great ability to answer any kind of prep question without you feeling embarrassed, right? So she'll call you
Right.
24 hours ahead and ask you about your prep. You can say, "Hey, Mike, the color of my excretion is still, dark. What does that mean?" She'll walk you through, "Hey, you need to be drinking more of the liquid." So she's able to kind of answer those questions that you might be embarrassed or because it's after 5, no one is there to kind of help you along.
Right, absolutely. Yeah, that's great. Well, I know you've had some remarkable successes automating the disability forms and, with orthopedic clinics and reducing the turnaround. I believe you had said before from 15 days to just 48 hours. Could you walk us through how Cassie tackles such a specific yet common bottleneck in the clinic operations?
Yeah, so orthopedic and sports medicine clinics are very very heavy users of medical records, imaging such as X-rays, but also
Right,
disability forms, back to school forms, back to work forms, and as you know, whether it's a workman's comp case where you're really wanting the doctor to give you that disability form so you can file for disability or even short-term disability with like Aflac and Geico. But the issue is that these clinicians, including nursing, are just busy, busy, busy. And it takes time to go to your office and fill this FMLA form. It takes about 30 minutes. And what you're doing is going into the EMR and lifting the DRG and CPT code so you can submit it to your insurance companies. You're only allowed to charge $25 for an FMLA form if you charge your patients for that. So it's not a money maker. So the issue that this orthopedic clinic was having, and now we have 12 that are using it, is that they were just not getting to their disability forms. And that led to a lot more phone calls because people are saying, "Hey, I need this form. I need this form." And it got to a point where 42% of phone calls into this healthcare system were never answered. And that created
wow.
some dissatisfaction. So it was taking 15 days for them to produce an FMLA form. So what we did for them is we put Cassie on their website. So whenever you go to patient services, you go to FMLA forms, and Cassie comes on and she'll say, what form do you need? Who was your doctor? When was your procedure? So now that she has also your authorization, to release that information either to yourself or to an insurance company, is she has the ability to go into the EMR, 24/7 and fill the form completely herself. And then again, we send it to the human in the loop and say, hey, do you agree with this so it can be released? When we did this, patients stopped calling because they were getting their forms within 48 hours. And we provide them a tracking number that they can track their form so they don't feel like they have to call in. It has been a game changer when it comes to getting forms that you need.
Well, I know that's huge. I mean, for me, in the past, I've had to call, when I was trying to fill out FMLA forms, and it's just so cumbersome. The website didn't have a lot of help, and I ended up just scrapping it and just calling on the phone to try to get somebody to fill it out for me. And that's what we did, and it would just take a while, to get things done. So this is very helpful.
Yeah, no, I was at a clinic in Westlake, Texas, which is about 10 miles from the Mexican border. And because they're having trouble answering the phones and forms not available, people would get in their cars, crowd the patient waiting room just to ask for that form. And I'm like, there has to be a better
Right.
way to be able to allow even like phlebotomy forms. People were coming in to get physically to go to a Quest lab or a LabCorp. So I really think that AI lends itself to increase the digital patient access. Similar to the way
Right.
that we bank or the way that we travel, we need to make it more efficient and be less human dependent.
Sure, absolutely. Well, thinking short term or short to midterm for Humanate Digital, what types of signals or metrics are you really honed in on to drive clarity across the organization and to ensure continuing to deliver such impactful results?
Yeah, big on education. Um, you
Hmm.
know, I think we hear a lot about AI in the media, but I would say about 80% of it is wrong. So a lot of it is educating the healthcare community as to what is AI, and then the intersection between AI and HIPAA security and cybersecurity. So education
Right.
is something that we strive for. So we speak at conferences, we have white papers, and so forth. The other one is a lot of people are afraid to try it out. So I remember, when Intuit came up with the Da Vinci robot in the city of Houston, I think MD Anderson put an advertising on the major highway saying, hey, we operate with a Da Vinci robot. Within a week, I was getting knocked on my door from doctors that said, hey, Mr. Rodriguez, can you buy me one of those? Right. So it was almost like fear of missing out. uh, so another KPI that we follow is, hey, we'll offer a 60-day trial. At the end of 60 days, I tell folks I can either go and sign a contract with you, I can go bring Cassie back with me, or I can ask you how many more Cassies do you want. So one of our KPIs is we track the traction of demo to contract, right? And we're trying to have that over 80%. So if we think we have a good solution for you, and we have a good scope of work, that means that after 60 days, we want 80% of the time for people to write a contract with us. So that's one of our major KPIs. The other one is patient engagement. What we find is that a lot of healthcare has gone to what they call conversational LLMs that replace chatbots. So now you're stuck with somebody on the phone. You don't know if they're not human, but you get frustrated. So we find that LLMs, people punch out at 70% of the time. We find that when we add the avatar that has expressive gestures, meaning that she blinks, she moves her eyes, her arms, that people engage with her a lot more, up to like 97, 98%. So we're able to kind of retain that person so they don't want to punch out to customer service.
Wow, that's amazing. I hadn't heard that before. That's very good.
Yeah.
Yeah, that's incredible. I didn't know that. I did know people would punch out after a while and they want to speak to a real, person. But yeah, that's really interesting.
And
Very
and
good.
I'll do something else, Donald. I I missed, I kind of missed this. I thought this was going to be for the younger generation. We found that the older our population is, the more they like this technology because it is
Wow,
so
that's
much
amazing.
because it is so much
Right.
easier to ask questions and speak to it than try to figure out how to fill that Adobe form, and then
Sure.
how to scan it and send it back to you or fax it to you. I mean, I've gotten a lot of good feedback from older folks.
Yeah, that's wonderful. I didn't know. But, well, thank you so much for your insights, Carlos. I think this was incredibly valuable, and I really appreciate your time and openness. And I'd love to, come back with you again later at some other date and follow up on some others stuff that you're doing. But this sounds great.
No, absolutely, Donald. I think we're at the beginning of something big, and I do think that AI is going to help healthcare and not only scaling up people's capacity to do stuff, like pre-authorizations and denials and all that kind of stuff. But also, it's going to open the door to patients to have better access, quicker access. And I think it's, the fact that it helps both the patient and the provider. I couldn't think of something better.